All right, let's go ahead and get started. Welcome, everyone. My name is Joe Mayer, and I'm the manager for political education and legislative grassroots here at the AMA. And I want to thank you for joining us for tonight's session, Fix Medicare Now in the August Recess, part of an ongoing series of training sessions from the Physicians Grassroots Network and the Fix Medicare Now campaign. With the congressional August recess upon us, the AMA's top federal priority is reforming Medicare's broken physician payment system. As many of you know, the August recess provides physician advocates with unique opportunities to engage with their members of Congress back home in the district. Over the course of the next hour, you'll receive an update on the current state of Medicare physician payment debate on Capitol Hill, including current legislation and what challenges and opportunities lie ahead in the remainder of the 118th Congress. You'll also hear about ways physicians can be involved in this process during the August recess, including how to prepare for in-district meetings, hosting members of Congress at site visits, and overall best practices for interacting and conversing with your legislators, both in person and online. We've also developed a suite of advocacy tools and resources that will be available to you, and we'll provide a link to these resources in the chat. For tonight's panel, we have David Lusk, founder of Key Advocacy, who has over 20 years of experience working in policy and government affairs, and he specializes in developing grassroots and grasstops training programs, resources, and content. Also joining us is Jason Marino, Director of Congressional Affairs at the AMA. Jason has been with the Congressional Affairs team for over 18 years, and along with his team of lobbyists, works to advance the AMA's legislative agenda in both the House and Senate. Before joining the AMA, Jason was a health policy advisor for a United States senator. Tonight's session will be approximately 1 hour in length and will be recorded. A link to the recording will be emailed to you after the webinar, and will also be available on the August Recess Advocacy Hub resources page that will be highlighted during tonight's program. To ask a question of either of our speakers, please use the Q&A feature on your screen. And if you enjoyed today's session, we hope you'll join us for future events. With that, I'll turn it over to Dave to get started. Dave, take it away.
Great. Thank you, Joe. I want to thank the American Medical Association for asking me to participate in tonight's event. And I do want to thank all of our participants for prioritizing this session in an evening as we get into this critical August recess period. So as noted, the August recess is now upon us. This is something that while we always have a chance every year to try and engage during August recess, this year being an election year poses a little bit of a curveball for us in that there's a period of time that if you have a member of Congress who is a Democrat, that we will be losing them to the Democratic National Convention in later August. The thing that I want to point out, while it might be a little bit truncated and busier this August, if you aren't able to get as far along with your lawmaker as you would like, we are going to see them back home in the district for certain in October when they're campaigning, which provides another opportunity to reach out, to interact with your lawmakers and to solidify any conversations that you had either in August recess or from earlier this year. The one thing that we do want you to prioritize, if you can, are conducting in-district meetings with your members of Congress back home in the district. Hopefully, you know how to reach out to your local district offices, but in the event that some of you do not know how to, you can go to your lawmaker's website. The one challenge is while we have one Congress and two legislative bodies in the House and Senate, we also have 535 members of Congress, each of whom operates as a small business at times. And so therefore, some of the examples of how to research your lawmakers tonight, it won't be consistent across every member of Congress. And so we'll get as close as we can to giving you a good idea as to where to look for certain things. But don't be surprised if you find your own member of Congress has their website laid out slightly differently. So in looking at Dr. Bera's website, if you are on his homepage and you mouse over the About button down to office locations, it drives you directly to where those offices are. And in this case, he only has one district office back home. If we look at Congressman Bucshon's website, if you mouse over the services area, you can find out when he has something called district office hours. And there's actually a listing of where these offices are and the times that they are open. By office hours, he may or may not be talking about sort of open office hours to stop by, but it is advisable that you try to actually schedule an appointment time. And as you can see in the Jasper office, appointments only are for visits in that location there. Now, if you actually go over to contact, and this is again varied from office to office, there's a way to actually schedule a meeting. And when you click on that, it brings you into a form that asks for various pieces of information. If it is a web form that asks for the organization name, we ask that you note that you are a part of the American Medical Association in your outreach efforts. If it does not include an area for organization name, please somehow reference the American Medical Association and this advocacy effort in the notes section of that web form. Just taking a look at another lawmaker's webpage. So again, from the homepage for Congressman Burgess's website, if you mouse over About Me and go to My Staff, it brings up a listing of both DC and district office staff. To contact staff in one of the offices, you can either click this button here, or if you're on this page, and you'll see that there's a meeting request area on this website that it takes you to. You can also access this either by the prior link that we talked about or by clicking on Contact Dr. Burgess. So just a couple of different versions of websites and how they're laid out. One thing that you definitely want to try to do if you have not yet is to subscribe to your newsletter, which is typically an e-newsletter from your member of Congress's website. And so in this case here, this for Representative Miller Meeks, it's right as you get onto her homepage, this pops up, and before you can progress to other pages, you would fill out your information here. Again, from office to office, these are going to vary, unfortunately, on the website. There's not one consistent way that they're laid out. Now, to request an appearance from Representative Miller Meeks, you want to go under the contact button, and you'll see where it highlights request an appearance and brings you to a page that looks like this, where you can actually denote the type of request that you want, whether it's a non-speaking appearance, such as maybe you're going to conduct a site visit of your practice or of your facility. Do you actually have a specific meeting request? Are you trying to perhaps host a informal coffee or some type of a town hall meeting where you're going to have other colleagues with you, where the lawmaker is going to be expected to speak for some period of time? And then within here, you can also note the date of the engagement, the number of attendees. One thing I would sort of point out, in the notes section, you always want to try to be as transparent as possible. In the event you are including colleagues, please include their name and possibly either their practice or the medical facility where they work. Also, if you can, in trying to schedule an in-district meeting, in the notes period, put as much flexibility or denote as much flexibility as you have on various days and times of those days, so that the office can try to fit you in as best as possible. Obviously, on this page here, there's the way the drop down is set up. It's just showing one specific day, but you can always denote those sort of options or that flexibility that you have in the notes section. The more flexible you can be, the more likely that office is to be able to fulfill your request. Now, I talked about trying to schedule an in-district meeting. That might not be something that is always the easiest to do in an August recess. However, if you offer an opportunity such as a hosted site visit, that can actually have some benefit to your advocacy efforts as well. Now, that can be a bit more involved than just an in-district meeting at that lawmaker's office, but it does provide a photo opportunity. And again, this is an election year, and lawmakers are trying to demonstrate to their constituents how active and engaged they are back in their communities, how much they are interacting with their constituents. And some of the nice things that are involved in a site visit is that you actually are able to control the setting and the agenda a little bit. And oftentimes, I've heard of advocates who have found they had much longer discussions because they were able to keep the lawmaker on site or perhaps the lawmaker was very interested in something they could show at their facility or at their practice. And it can lead to a much more robust discussion than what you might just have in an office meeting. Now, one of the other things that we often talk about in engaging with your lawmaker back home in the district is to go beyond these formal meetings or these site visits. The most important thing is to remember anytime that you engage, being back in the district, that's just as effective as engaging on a Capitol Hill meeting if you were to come into town for the National Advocacy Conference. We've seen a number of different surveys of congressional offices that focus on the fact that it's the what that you do, not where that you do it, that helps it be so effective. Lawmakers really do need to hear from their constituents. And again, in an election year, it's even more important that they're able to address any types of constituent concerns. Now, there are a lot of opportunities to interact and engage back home in the district. There are scheduled lawmaker events that you can possibly attend. You can also briefly visit with a lawmaker at various community events that might be happening around the area. The tricky element here is finding reliable calendar and event sources of these different functions that are going on back home. So here we are. If we go back to Dr. Bera's website, under news, we see upcoming events. And if you click on that, there is an event that he just recently had. And so ideally, this will be updated for the August recess if there's something else that the lawmaker is hosting. For now, we can see there's just one event on July 23rd. But when we go into Dr. Schreier's website and we click under the About Kim, where there's an events tab there, we see for town hall meetings, there's nothing that's scheduled. For community appearances, there's nothing that's scheduled. And even if we go to her calendar, there's nothing on the calendar for August. Some of this is based on the fact that we've at times in the past had some perhaps aggressive appearances at lawmaker events. And if they're too widely announced or too far in advance announced, then it can be a little bit more challenging to have a calm and safe environment. Because obviously with the events we've seen this summer, safety and security is a concern among any lawmaker, especially at the federal level. The one thing that I'll point out that while they may not have this on their websites, because it can be a little bit more challenging for the staff to maintain the websites and keep them up to date, by subscribing to their email newsletters, that's where you'll get a lot of the notice. And sometimes having a week's notice is a really advanced sort of time to be able to meet with that lawmaker or to attend an event that they have. So you also want to look for other sources of community events. And as I went through social media preparing for this session, I did not see lawmakers listing a lot of upcoming events necessarily on X, the platform formerly known as Twitter. But if you do go into their Facebook page, and in this case, we're looking at the Facebook page for Bill Cassidy as a member of Congress, as a senator. There's a tab that every lawmaker has that says mentions. And if you click on this tab right here, what pops up is anytime someone tags the lawmaker in Facebook, tags their page, it brings up that post under mentions. And so here we can see that the Central Louisiana Regional Chamber of Commerce is having a luncheon that they're inviting folks to attend to be able to see Senator Cassidy. And this was something that, while this has already happened, you'll notice, though, where it shows the timestamp on the event that this was actually posted on July 12th at 11:14 a.m. So you had about a 5-day window to prepare for this event. Now, it's not just a lawmaker's profile as a legislator that you can find on Facebook that might list events. You can also go to, most lawmakers have some type of a campaign profile on Facebook as well. And in this instance, in the area of North Carolina where I live, we can see that Alma Adams has an event coming up next week in August, and that this has been posted on her Facebook page since around July 19th. So while we're looking at those lawmakers' pages, one thing the other thing I do want to point out is within Facebook, what I have seen in my communities here in North Carolina and when I lived in Virginia, you may have a town Facebook profile. There may be some type of a media profile that sort of tracks what's going on in the community. And a lot of times they are posting on social media, predominantly Facebook, occasionally sometimes Instagram, when lawmakers are making appearances in the district, what those types of appearances will be. And that gives you an opportunity to reach out to the lawmaker at that event, say hello, reintroduce yourself if it's been a while since you've talked to them. But the one thing that happens when you're going to interact at these community events is you really have to expect this interaction to be brief. It's likely only going to be just a few moments. So you really can't plan on engaging in a full policy discussion with that lawmaker. It's more or less just that you're trying to touch base, perhaps find out when they might have availability, who you should contact the next day to schedule something. However, if the lawmaker does start to engage more deeply into a policy issue, definitely don't cut that conversation off. Go ahead and have that conversation as long as it seems possible. Just understand that you're also going to be out in the open in a public setting. It's not as easy to necessarily control conversations that way, but you certainly don't have to cut that conversation off if the lawmaker is wanting to engage. If you haven't yet had a chance to schedule something with that lawmaker and you're trying to leverage this community event to do so, go ahead the next day and follow up with the relevant staffer during the next business day to go ahead and schedule that more formal engagement that you're looking forward to. And it's not just engaging in district, in real life. Don't forget to also interact with your lawmakers online. And this can help sort of set the table for having a chance to have a more extensive conversation in person, either by being an active advocate rather on social media, and also being certain to tag your lawmakers or sometimes interacting with your lawmakers online. That can help really sort of raise your profile, as we've seen with Dr. Heine, as well as being able to set that opportunity up to have a more detailed conversation, or at least be a known name to your lawmaker's office when you do reach out to try and schedule some type of a more formal interaction. I know I've gone over a lot of things. I've talked about a lot of ideas. We did prepare, just as we did last year, an August recess engagement guide. This will be on the hub that we'll be talking about in a few moments. This is intended to help you out with your August recess efforts. It includes ways to research your member of Congress if you're not certain as to how to reach them, where their offices might be. It also includes sample scripts for anything that you might want to do, from reaching out by phone to filling out a web form to request one of these meetings and sending a follow-up email. And while it's sort of entitled as the August Recess Toolkit, it's something that's applicable to in-district efforts well beyond August through 2024. And so here's a table of contents, just looking at what we have in this guide. And you can see a number of different elements that are in here, including some of the materials that Jason will be going over, both the Medicare provider updates chart for 2025, as well as the increase in inflation relative to practice costs. This toolkit is designed that you could actually print this out and have everything that you need at your fingertips in one document if you wanted to take that with you. So that's sort of the design of that. And where you can find some of these materials and additional information is within the Fix Medicare Now website that the AMA has created. They also have a subset where there's a August Recess Advocacy Hub that will include the toolkit and other materials, including some of the materials that are in the toolkit broken out as standalones, including the charts that are there, the one-pager, or the issue brief, as that's referred to. You can also, if you haven't yet, sign up to join the Physicians Grassroots Network, or the AMA's very influential physician program. And they not only send out occasional emails seeking certain types of action, but they also have additional information based on policy issues as issues arise throughout the year. So with that, I'm ready to hand things over to Jason. And I think he's going to go into our policy conversation and the status of legislation on the Hill. So.
Thank you, David. And thank you everyone for participating in this webinar today. I know you're busy schedules and you've carved out time for this. And I thought my part of the presentation is I was going to walk you through just some more of the context about Medicare payment reform and what some of the asks might be for your meetings this August. I see a chart right in front of me. This is the chart that unfortunately you're living. This is a chart that of what you've lived and what you're living from 2001 to 2024. If you look at what your practice costs have been, what the MEI is, which measures practice cost inflation, compared to what physicians have actually gotten under Medicare, it's 29% cut, loss, decline. And why is that? And then the next slide, you'll see what's happening going forward for 2025. And you'll see, well, look at other providers in Medicare, hospital inpatient, hospital outpatient, hospice, ASCs. Their inflation is about 2.6, and they're going to get 2.6 because current law allows for that. And you look at physicians, the MEI for 2025 is going to be 3.6, but according to the most recent proposed rule in July, this last month, they're projected a 2.8% cut in Medicare. So not an MEI increase to keep up with cost, but a 2.8% cut. So after 2001 to 2024, 29% loss to inflation, and then going forward, it's not better. It's a 3%, a 2.8% cut. So there's a lot of frustration that you're feeling, and it might seem hopeless. And I'm here to tell you that there is hope, and give you some context for how we can confront this and get this program, Medicare program for physicians, fixed. And let me start by just saying that when we started giving you some landscape of some of the 118th Congress and some of the progress we've made, and then where I see it going forward in this last stretch of the 118th Congress. When we started in 2022, the 118th Congress, no one was talking about macro reform. Didn't even know what macro meant. A lot of the staff were new, a lot of turnover. They didn't know the history of the old system where there was the SGR and all these years, 17 fixes and all these cuts, and there were 27% cuts in 2013. That history was gone. And there's new staff, new members. No one really thought there's no problem with macro. They didn't know what macro is. So there was a lot of legwork that was done by a lot of you, a lot of our AMA lobbying team, a lot of the state and specialty groups, educating members of Congress and their staff on what is macro, what was the intent of macro, what's happened, what's the history been, what's the problem here, why is there not an update, and it's not just the update. There's the different components of the Medicare payment system, and that relate to MIPS. That's the fee-for-service part that also has quality measures and has meaningful use requirements and has cost requirements and different measures. And then there's the APM side of macro, the alternative payment models that were promised to come years ago, and they didn't come. They didn't flourish in the way that was hoped, that was intended. A lot of physician specialties, a lot of physicians, based on where they live, they just don't have an APM available to them. And so there are a lot of challenges to the payment system. And so first started educating members of Congress and their staff, hitting every single one of them what the problem was. This is an issue. We had the thank you for those who participate in the national advocacy conferences every year that we have in the winter. And then last year, a lot of you, maybe on this call, did some visits, and you've done visits throughout the year. And we made progress, and we did get a marker bill, a bill dropped that would allow for the permanent MEI update, permanent inflationary update for physicians. And that was the HR 2474, the Strengthening Medicare for Patients and Providers Act, is in the materials that you'll have linked to. But that bill is the gold standard to give physicians the update. And we got that introduced in the first session of the 118th Congress. And right now it has about 152 bipartisan co-sponsors. We're trying to grow that list. But then we've also developed reforms for budget neutrality. If you look at that 2.8% cut, that's because of budget neutrality. When they increase the service in one spot, it leads to across the board cuts for everyone. And it's a bit broken. It needs to be modernized. It needs to be reformed. And there's legislation that we worked on, the AMA worked on. We convened a task force and a working group of several of the state medical societies and physician specialty group representatives and came together more than 2 years and worked line by line. How do we fix this? And then we sold it on the Hill and got a bill dropped. And we got it through some of the committees. So one of the key committees. And then on MIPS, this is that mentioned that the quality part, the fee for service part of Medicare that's broken and that's set up as a tournament model. You get a score based on all these different metrics, and how you do in the score determines whether you get a small bonus or you get a cut, and the cut can be as high as great as 9%. So in addition to that 2.8%, 9%, and some physicians, you're living this. My most recent visit with my physician, he was trying to do some small talk. I'm AMA lobbyist. And he came back and said, I'd love to talk to you. I don't want to be rude, but I have to ask you these questions. And I know I'm looking at my screen and not you, but that's just how it is. And I try to explain what I'm hoping that my day job is to help you so you can look at me, but I understand. And that's the reality. And some of these measures don't relate to the real clinical world of your patients, or they seem check the box, or they're just outdated or not relevant at all. And they're timely, and we measured how much it cost. It cost, thousands of dollars to just to comply with these MIPS requirements per year. 12,000, I think, a year. And then you ask the hypothetical question, which we ask on the Hill. In the last 10 years, what has MIPS done to improve patient care or lower costs, or what one thing? And there's never an answer. That's a problem. Never an answer. So you're not even keeping up with inflation for payments, and then you're making physicians jump through all these hoops in the broken system. So the AMA also convened another working group with several of the state medical associations and physician specialty groups representatives, and came together and got some outside consultants and tried, let's figure out how to change this, how to make it work better. And in a way that doesn't break the bank, that has physician buy-in and ownership of, and ends this Turner model where one physician gets a little increase and someone else gets a cut. And we came up with a solution, and we have one that we're actively pushing on the Hill to help address that. And on the alternative payment model front, we're working to help build the pipeline so there's more alternative payment models that come on board, and then that physicians are eligible to participate in those payment models to get the bonus that was promised, because there was the bonus promise with MACRA, but no one was able to take advantage of that. So take advantage of that model. And so in all of this has led to all of the key committees in Congress: Finance Committee, Ways and Means Committee on the House side, the Energy and Commerce Committee, have all been much more actively engaged. They've had hearings on the MACRA issue now. They've had RFIs, which requests for information, where they ask, how would you reform this? And they put out for the public and groups like the AMA and other groups to submit suggestions. And every single one of those, we've given them piles and piles of suggestions. Here's how you do it. Here's how you fix it. And we work with the specialties and the states, and they've submitted things as well. And every opportunity for dialogue and engagement on any hearing, any touches Medicare, VMA, for instance, we've submitted testimony. Here's how here we have solutions here, and there's been progress in it. You don't hear about it because it's not the type thing you hear about in the news media, because it's not something they publish. They're focused on the more controversial issues. But there has been a lot of behind the scenes by the leadership staff on the House and Senate, and the key committee staff who write the bills have been engaged like they haven't but in recent times. And they're trading papers back and forth, ideas. They're having multiple forums with them, meetings to really get down into the weeds on some of these things. And that's promising. And I know it's not seen, but it is. And these things are, even if they don't pass, overnight, they do lay a foundation for a future time where they build on it, and they have that file where they made some progress, and you don't always know when your opportunity is going to come, but we're planting the seeds for that. And I would say most recently, this is all culminated in a letter that was sent to House and Senate leadership on July 24th that was signed by all 50 state medical associations and 76 of the medical specialty societies. So since you have all of medicine writing a letter to House and Senate congressional leadership saying we need to solve MACRA. And it's about not just about physician burden, it's about patient care and patients' access to us, to physicians, to quality care. And we're not just complaining. Some groups come out and they throw all these problems out there and they never offer a solution. Well, we have a legit problem in MACRA, but we've done all of the work and extensive work on solutions. And in the letter, it had the 4 pillars to how to reform MACRA. It's not rocket science. It did take some work, but we have solutions. We have the bill to allow the Medicare update based on MEI. We have the bill that would allow for reforming this budget neutrality process. We have legislation to address alternate payment models. We have a very detailed proposal that we've unveiled on how to reform the MIPS program. And it's all out there. And they do behind the scenes give credit that we are coming with solutions. And we have all the solutions. Here's the problem. Now it's in their court. Now it's in Congress's court. What are you going to do to help advance this? And there are challenges in that to give an update, the Medicare, the MEI update over 10 years would probably cost ballpark, from the Congressional Budget Office, there's no official score, but it could cost about $300 billion or more. It's a big, big, big cost. And that's a big obstacle because, we're at a time where there's a national debt of $34 trillion and a massive annual budget deficit that exceeds even the defense budget. And so that members of Congress are very cognizant of costs right now. So it's not easy to pass a new spending bill. And Medicare, people are concerned about the future solvency of Medicare. And so the idea of adding new money for physicians, is not always the first. It comes with some resistance. And we're aware of that. But they need to see the cost of inaction, the cost of doing nothing. What happens if you just let this system wither and you don't address it? And what's going to happen to these physician practices that may disappear or have to get bigger or consumed or have to make tough decisions? And what's the cost to the system of that? You're not counting that. CBO does not measure that. And that's the story. That's the point that we need to make it so they're not just so focused on a number. And members of Congress, it's a tough job, but it's about they're the ones that were elected to make some tough decisions. And we're in a situation where they need to make some tough decisions to address this issue. And it might mean that they have to sacrifice some other program or some other entity or do some make some tough decisions to prioritize finding the dollars to address it. And we're under no illusion that this is something that's going to happen overnight. It's not something that's going to happen immediately, the permanent $300 billion. But we've laid the foundation that they can start taking some of the proposals that we put out there, and they can do some things as a down payment for this year that they can build on in the 119th Congress. And we've made progress where they can do that. And so here we are. The House and Senate are in recess, and they're in recess in August. As David mentioned, there's also going to be a recess in October. Yes, they're very focused on the election, but they still can have time to focus on some of the substantive policy issues that we're presenting. And so we're in a moment in time where it's critical that members of Congress hear from their physician constituents back home about this. It's not just a DC lobbyist play. It's also the physicians who are directly affected, who can tell the story back home. And I think my advice for the August meetings is to use these 2 charts in your meetings, and then use those 2 charts to build into a personal story about how those charts affect you personally, how they affect you as a physician, how they affect your practice setting, your practice situation, the people who work for you, the staff who work for you, the office expenses that you have, the patients that you see, the patients that you might not be able to see maybe how this has affected some sort of patient interaction or how you fear it might, and what it means to you and why it's so important. And why, yes, it may be costly, but it's costly not to act. And we really need your help. And this is an urgent issue. And and telling the story is what makes these charts. Sometimes these charts, they get presented with lots of charts. And they're always a little skeptical, members of Congress, because they get a lot. And it can be a little mind-numbing. But if you have a good chart, and these are good charts that we've poll tested, and the people see these charts and it does move well, and members of Congress have comments that these charts are very effective. But a story to accompany the chart is key. In your own words, how it means to you, to your patients back in the state, back in the district, and how these cuts mean. And I will say the stakes are high because it's a big ask. It's not a normal ask. It's not like a telehealth that a lot of groups support and it kind of has a lot of momentum behind it. This is something that if you don't talk about it back home, the patients may be sympathetic if they're even aware there's a problem like this. They have other issues. They're not going to bring it up. They're not going to use their shit, so to speak, on the member of Congress to talk about payments for physicians. It's just not going to happen. It's only physicians that can push that will weigh in on this one. And it's a tough one. It's a big lift, but members of Congress respect physicians and what it means to be a physician and how highly credible physicians are and how they respect it, and patients trust their physicians and they know that. And it's also a situation where you can't be in a meeting where you bring up 2 or 3 other asks because if they had that, they'll grab the easiest ask they can get. But it's also, this needs to be prioritized because it's such a big ask. And they may come back with the numbers about how much it costs and it's overwhelming. Well, why they can do something for this year? Why can't they knock out that 2.8% cut and give the 3.6% update for the year for 2025? They can do that. They can do something. There's no excuse for total inaction. They can take some of the MIPS reforms and put them into law. There's things that they can be done. And so they're going to go home they're home in August and they're going to come back for 3 weeks in September. There'll be a flurry of activity, but it'll be mostly about how to get funding temporarily to get them through the end of the year or into the lame duck session. And the lame duck session obviously starts after the election. And so to be just before Thanksgiving and then December, there'll be a very robust lame duck session where they've had the election, who knows what happens, but then there'll be a flurry of activity. There'll be some members that lost, but there's still going to be members of Congress until it's sine die and the Congress ends in January. There'll still be members and there'll still be activity, and there historically has been activity during the lame duck session. And that's where we're really pushing for the action we foresee the most chance of things happening in that lame duck session. And so all that you're doing now is helping plant the seeds in the members' heads and create the political will for them to step up and to do something on this front. And a lot of that is giving them and letting them, and it's very important that these aren't one and done type of meeting. This is you meet with them and then you try and set up the next meeting for November or October, so they know they're going to see you again. Because when I worked in the Senate, you always remember the constituents who made a point that they're going to meet you again. And when you're meeting them the next time, you're always thinking, oh my, what have we done since we met them last time? I hope we got to have something to say, some progress. And even the boss, the senator, would ask, what have we done? What have you done, Jason? And that's important. And then they know you're going to be continuously part of their life, and you're going to be asking them questions. And we've given them, where are we on that bill, HR 2474? Where are we on this bill? Where are we on the MIPS reform? All these things that will link you to. Where are they? And you'll be the face of it, your constituent back home. And then they know that you're someone that people back home listen to. And so that's important. And so I would encourage you not to let frustration and the enormity of the issue paralyze you. It is a situation where you play the long game, you get the wins along the way, and you build momentum, and you wear them down. But it all does relate to a good story, the good chart that we have here for you, and creating a sense of urgency and then a continued dialogue. We're not going away. We're not going away. This issue is too important for that. Too important for that. This is about the future of Medicare and patients' access to physicians. And And while they can get overwhelmed with other issues, this is why you're there meeting with them to prioritize this issue and make them encourage them to make the tough choice for this issue. And thank you again for participating tonight and in August. And I know that it takes some time to in your schedule to even do these meetings, but it's worth your time and it's appreciated.
Yeah, thanks, Jason, and Dave as well. We do have a few questions that came in, actually more than a few, so that's really good. One of the first questions, or it was more of a statement, but someone pointed out that Dr. Bashan is not running for re-election, and that actually goes for Dr. Burgess too, who was also mentioned in Dave's section. Can you both speak to the importance of, while the member, and they don't have to be physician members, but your member of Congress may be retiring, why is it important to continue to advocate? Because there's still a legislator until the end of the Congress, and through the lame duck. So why is it important to continue to engage those folks?
I'll jump in here if that's okay. First, Jason, I'm glad someone noticed. I kind of did that by design in picking lawmakers who were leaving. And so I really appreciate someone paying attention and picking up on that. One of the things that happens toward the tail end of a Congress like this is when we see lawmakers who aren't coming back. You have to remember that they're no longer sort of facing the voters in the future. They're also no longer beholden to leadership and what leadership might say. So what can happen is, if your member of Congress is someone who has not been a champion for increasing physician payments, they might now become a viable supporter, since they aren't going to face the voters again, and since it doesn't really matter to them what happens with leadership. So you can oftentimes see someone almost flip sides on an issue, or if they, again, maybe they weren't quite an opposing voice and they just were a bit more neutral or uncommitted. We can find that's a great way to make them a champion. So Jason, I don't know if you have anything you want to add to that.
Yeah, and I would add, for example, like Congressman Bashan, he's our lead on that bill I mentioned, HR 2474. He's a Republican lead for the MEI update. He wants to leave a legacy. He cares deeply about this issue. And if he could help do at least a partial implementation of that bill to set it up for future Congresses, like he would, and someone like him, he's well liked by respected by his colleagues on both sides of the aisle. They might want, a lot of times the members that retire that are beloved and appreciated by both sides of the aisle and their leadership, they want to give them something on the way out. And this isn't a controversial issue. It's just there's a cost to it, but that can be we could have a spark because of that. And Dr. Burgess the same as well.
Well, I think that kind of follows up with this, Jason, and this may be a quick answer, but I think what I'm hearing is cost. So what's the main opposition to fixing the physician Medicare payment issue?
Yeah, I mean, the main reason is the cost and the potential for a 300 billion plus score, and nothing really is cost that. I mean, that would be it'd be the largest healthcare expenditure in a while, and how would you pay for it? And it's overwhelming in a time when everyone's just kind of figuring out how to reduce the debt and deficit, and it scares members. That's the biggest obstacle. And then, the one that's usually an obstacle for every issue is just that there's so many issues and you got to compete for members, and you want them to get them to want to engage in something that some people might think this is kind of a technical, not as exciting issue, but it's a very important issue.
Yeah, totally. So another question is, if we're able to get our legislators to meet with our entire county medical society, do you have any suggestions other than what has already been mentioned on what we should say to drive home the need for payment reform?
That would be an incredible opportunity. If that would be a great, if that was able to occur. And in that situation, I would advise that, you have a lead person that kind of walks them through the charts to kind of frame the issue. And the good thing about where we are now in the state and the Congress, the members all know the issue now. Like, this is out there. This is not, but show that chart. And then I would have them go around and say, you know, we want to give it a chance, each of them, to go around and tell their story about what those charts mean to them and their practice and their patients. And let them hear, like, I'm from this county, this part of the county, and I practice here, and this is what this has done to us and my patients. And then I'm in this part of the county, and this is where I practice. And that will have an impact. And please, we need you. We need your help. This is an urgent issue. And we really, and be respectful. You don't want to have a gang up situation where it turns hostile, because then everyone gets in defensive posture. But it's a great chance to have everyone go around and tell a story. And that'll get in their head and will stick with them for years sometimes.
Joe, if I could chime in a little bit on
Yeah,
this as
I
well.
was just going to say, Dave, go ahead.
Pulling together the county medical society like that is most likely going to bring a number of different stories to this engagement, whether it's a meeting, whether you're hosting that lawmaker over a coffee. And so therefore, and I just go back to the rural setting where I grew up in southwestern Pennsylvania. And there were times when I would see my parents struggle with going in to see a physician. And there was someone my parents had seen for a long time, long waits in that waiting room. Suddenly that physician was no longer taking or accepting Medicare patients. Now that means a shift to other providers in that community. And it just ends up becoming a bit of a longer burden as far as waiting in the waiting room a little bit longer. Other physicians are now getting a little bit overworked. So if you have stories like that of what has been the results of something like someone dropping Medicare patients, what has happened to other physicians or even to the patient outcomes. You know, sometimes it isn't all about money, and it can actually be about better outcomes for folks as well. And we tend to forget about that sometimes because Congress is so focused on dollars and cents.
Well said. Got another question here. If I already met with my member of Congress this year, should I still schedule a meeting during the August recess?
I would say yes. I'll jump in. Yeah, definitely please engage your members of Congress, because we definitely need to stress to them, you know, our position on the need for reforming the physician payment updates. You know, until we see solid numbers on this, until we achieve success, it's something that we still need to keep working on. And also it gives us another opportunity, if that lawmaker hasn't yet become a champion, another opportunity to talk to them and find out why they're not a champion, why aren't they supporting us, or why are they uncommitted. And it's always a good opportunity to try and stress or revisit or find, is there information or something that another organization or their constituents are sharing that gives that lawmaker pause that we can better address.
Jason, you have anything to add?
I agree everything Dave said, and I would just say that the more you can meet that as appropriate, the better. The more their stronger relationship gets, the better. When I worked in the Senate, there were 2 or 3 physicians that the senator always had to hear from. They evolved into first namers who had the extra status and at times too much. And as a staffer, I thought they were too influential, but they were influential, and they weren't too shy about trying to meet. You know, there's a fine line, but they weren't too shy, and actually I appreciated it over time because they had expertise to share.
Yeah, Jason, this was probably for you. It's a little bit of a trickier one, but how do we combat or deal with the perceived fact or the perception that a majority of physicians may now be employed in health systems, and if health systems are getting an inflationary increase, then those physicians could be getting higher pay?
It's a trickier one. It depends on this,
right.
But it could be that, I guess you can ask the question: Are those payments larger because the hospital payment system, it's a more generous reimbursement system, as those charts show? Is that trickling down to the physicians that are employed or contracted with those hospitals? I don't think we always hear that that's the case. Their underlying fee-for-service system does derive the payment system to some level, so that does impact the hospitals. If there's cuts in Medicare physician fee schedule, it does impact the hospitals, and if it in a detrimental way, and that might be taken out on the physicians who are employed by them, well, we're getting less for Medicare, so we got to kind of share some of the pain here and some of the cuts here. And so it is relevant. I think it can be relevant.
Thank you. Another question that came in, probably more for Dave. Well, actually for both of you, sorry. So this person had met with their member of Congress earlier in the year, and she indicated that she was supportive of Medicare physician payments. Do they still need to meet with that member?
I would argue absolutely yes. First of all, depending on when you met with them, what was the status of other lawmakers? When you meet with a champion office who has supported us, what other things can we say to them besides thank you? Are they willing to go to the chamber floor and make a comment in support of our position? Or are they willing to write an op-ed that would appear in their local paper, or, and certainly it could end up being statewide? There are ways to get lawmakers on the record supporting us that can be very beneficial. And I'm certain the AMA, if anyone wanted help in composing either a statement or some type of an op-ed, that the AMA staff could provide that benefit to them. The other thing too is, who do these lawmakers typically work with? Are there, you can ask that this champion office if there are other members of their delegation from the state that we think are on the fence that we could push just with a little bit of constituent engagement and get them to our side. Are there other lawmakers that they typically co-sponsor legislation with? And one of the most popular reasons why lawmakers join together, especially if it's bipartisan legislation, is surprisingly is because, actually not surprisingly, because they're located in the same part of the office building and where they are working. And so I've done that as an advocate myself, where I've gone into champion offices and found out, who is it that's already on the fence, or do you know of other lawmakers that we could talk to, and then provide that polite pressure. And it has worked. This past year with one of the groups I worked with, I picked up 5 co-sponsors by doing that. So that's not bad for a day's work for a constituent who's not a professional. I was doing this as a constituent, not as a lobbyist. So not a bad day's work for someone who's not a lobbyist. So.
I would just add that, let's say they say, charts are terrible. I mean, that's just terrible. We need to, I'm all for reforming the Medicare payment system for docs, for physicians. Well, then my first question would be, well, are they a co-sponsor? Did they get on HR 2474? Or are they on any of the bills? Are they on that bill? And that's the first. And if they are, then, and if they're on any, are you in finance or I mean, are you on finance? Are you at E&C? Are you Ways and Means? Are you Ways and Means or E&C? Can you go to leadership and encourage them to include this or some version of it in the lame duck in that final package? There's always the next step you can do. But the first one starts with, especially the MBI, that bill. Are you on the bill?
Yeah, totally. And Jason, you threw out some acronyms there that maybe some folks don't understand. So could you go back real quickly and just give us a sense of what you're talking about with E&C? Like, what are our committees of jurisdiction that are the most important committees, both in the House and Senate?
Right. So on the macro reform issue that we're pushing in the Senate, it's the Senate Finance Committee. That's the committee that has jurisdiction. And then on the House side, there's 2 committees. And one is it's the Energy and Commerce Committee. And then the other one is the Ways and Means Committee. And so those 3 committees are, of all the committees, those are the most important on macro reform. And then after that, it's leadership. But a lot of times the House and leadership are going to defer to those committees.
Great. Thank you so much. This one's probably for Dave. So what's the best or preferred way to engage members of Congress during the August recess? Should they try to conduct site visits or an office meeting? Because site visits can be a little bit more difficult, but is there a more bang to the buck for that if they try to go that route?
That's a great question. And, there are pluses and minuses to both types of engagement, right? If you're hosting a site visit, there is a bit more work that's involved. However, just like we heard one of the questions that came in about pulling together members of the County Medical Society, it gives you an opportunity to possibly pull together colleagues to include additional stories rather than just your own personal story to drive home the points that we need. The other thing about a site visit is it allows you to better control the flow of conversation, perhaps prevent interruptions that could occur in their district office. But it also might allow you to share more concrete examples of, the impact of policy on healthcare. If you're in a private practice, if you've got a waiting room that's already packed, and you could then make the case, well, what if another physician in our community stops taking Medicare patients, and this is going to drive up the wait time for all these other patients who are coming in to see me now. There can be, and I think this is really true in what we see in underserved areas, whether that's rural areas or sometimes you get into the inner city. It just can really pose a problem, especially if patients are having issues with transportation. So sometimes it might be that they could easily get across the town or the county if they had transportation, but they don't. So again, there are pluses and minuses. If you don't have the time, certainly we want to see you do something with a face-to-face meeting. But lawmakers, again, in an election year, may appreciate a site visit because it's a photo opportunity. And even earlier this year, when I was on Capitol Hill, there were several different offices where members of the staff for that lawmaker were taking pictures of our meeting because they knew it was something they could use in a newsletter. So remember the value of those types of opportunities and the optics that come with it.
Okay, we'll probably end on this. I'm sorry we have a few more questions, but we're running out of time here. Given that it's an election year for Congress, not just for Congress, but also for the presidency, is there really still time during this Congress for policy changes to Medicare physician payments? I think Jason spoke a little bit earlier about, lame duck might be our best play, but I wanted to throw that question out there that was submitted and just see what you all think about that.
Well, see, from now to the end of the year, they're going to come back for about 3 weeks in September, and there may be some opportunity to get some advancement on some of our priorities in September. It'll be difficult because a lot of the debate in September is going to focus on keeping the government funded. They don't want to go into the election with a shutdown of the government. And they're in a tough spot to get just a short-term extension. And so there might be some committee activity. There'll still be what you won't hear about as much, but there could be some more RFIs. There could be some of those committees I mentioned could do a discussion draft on something. So there may be something, they'll certainly be thinking about it at the committee staff level. The committee staff are now campaigning. Like their job is in DC working on policy for the committee. Their job is not the campaign. So, and that's who we talk to. So they're still engaged, but realistically, as far as activity to get to law, that's going to be the lame duck session right after the election, where they're going to try to have a big, massive, likely package where there's going to be a lot in there. And we want to be in there with some things that are important.
And Jason, just real quick on that, can you describe what that timeline kind of looks like for the lame duck?
Yeah,
some folks may not understand the lame duck.
So usually what happens, they're all focused, all the dialogue, all the rhetoric, all the back and forth is all about the election. And then the election happens and who knows what's going to happen. And and then you got to digest the election, whatever happens. And it takes about a week to absorb that. And then very quickly, certain members that are leaving their offices are taken away. So they're in hallways. But it starts moving the week after the election. They start realizing, okay, we're going to reconvene, and they start thinking again about lame duck, and they start gaming out. They take the Thanksgiving week off, but just before the week before Thanksgiving, they really start thinking about what they're going to do in the lame duck, and they start making some initial decisions what might be out and in, and then it really picks up that first week after Thanksgiving. It intensifies. And so that early December is a very critical time, and it can go all the way to, the 16th, 17th, bleed into December, all the way up to the 25th, but usually 26th. And, worst case scenario, you never know if it's so contentious and so ugly, they could just say, we're just going to punt everything and go to next Congress and just delay everything. That hasn't happened recently. And we're gaming out and we're preparing for things to happen and to come in during a lame duck session.
Well, great. We are over time, so thank you all for participating in tonight's webinar. Again, echoing what Jason said earlier, we know you all have busy schedules, so thank you for taking time out to join us for tonight's webinar. As I said in my opening, we will be sending an email tomorrow with a copy of or a recording of the webinar itself, but also with a link to the Advocacy Hub, which was also put in the chat function. And again, I can't stress enough, as Dave and Jason had already said, how important the August recess is, and the really unique opportunities that August and your members of Congress being back in their districts, what kind of unique opportunities are provided to you to get in front of them and to really help drive the conversation on this topic. So thank you all for joining us. Jason, Dave, thank you for taking part tonight. And we hope to see you again at a future webinar.
Thank you.
Thank you, everyone. Have a great evening.